Welcome to the PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. Hello, and welcome back to another episode of The PA is In. Today, we have a guest, a pediatric PA, a personal gaslighting medical warrior, Kaitlin Pond. Kaitlin is a pediatric PA. She is an author of a children's book all about heart health. So we're going to dive into how to talk to kids about diet and nutrition and exercise and all of these things that keep their heart healthy. And then we're going to pivot and talk about her own personal health journey and her experience with medical gaslighting and how we as providers can be more compassionate, better listeners, and more alert to patients' feelings and their symptoms when we are seeing them. Without further ado, here she is, PA Kaitlin Pond. Kaitlin, welcome to the show. Thank you so much for being here.
Thanks so much for having me, and I'm excited to be here.
Could you take a moment to introduce yourself to our listeners if they aren't already familiar with you?
Yeah, so my name's Kaitlin Pond. I'm a physician assistant that's located in Virginia. I currently work in pediatrics. I've been in practice for about going on 3.5 years now with the same organization. I started in family medicine, but then transitioned over to pediatrics about 1.5 years ago. And I don't think I'll ever leave because I love it there.
So tell us a little bit about your journey to becoming a PA and where this passion and love of pediatrics came from.
I think it's just I've always loved working with kids. Even when I was in high school, I actually ended up in like I think it was like a third grader gym class, just the way my scheduling worked out. And I love just hanging out with the kids so much. And I feel like I have a rather eccentric and kind of like, I guess, lively personality. So it fits that very well because you have to be kind of relaxed and fun in pediatrics for them to trust you and enjoy it. But my journey to PA school was or to being a PA in general, is I just always loved healthcare. My mom's a microbiologist, and she always wanted me to be a microbiologist, but I always never wanted to do that. But I knew specifically I wanted to work in healthcare in some aspect. And I actually volunteered at the hospital in pet therapy for a little bit. And I kind of got to see a bunch of different aspects of medicine doing that. And then eventually kind of fell on PAs and just fell in love with the idea of being a provider, but also working in a kind of interdisciplinary team, that the schooling wasn't quite as long as going to med school, more like you could have a little bit more, I don't want to say autonomy, that's not the right word, but more control over your life a little sooner. So I liked that. And I also just met a bunch of PAs who were wonderful. And I was like, that's exactly what I want to do is be awesome like them. So I decided to apply. I got very lucky and got in my first application to PA school. And I went to PA school at Sal's University in outside of Philadelphia.
Ah, okay. That's not too far from me. So you have done a lot of work and promotion and sharing about peds, but also pediatric heart health. So where does that passion come from? Why is that so important? Why do we need to be making sure kids understand things about the health of their heart and how that affects the rest of their body?
Yeah, absolutely. So it definitely is a passion of mine. I think the biggest reason is because, as everybody kind of already knows, is the rising obesity rates in children, and also the rising rates of cardiovascular disease in the U.S. in total. It's still the number one killer in the U.S. And a lot of times I think we kind of have this notion that what we do as children doesn't affect us as we get older, but it really does. I mean, studies have shown that we start putting cholesterol in our arteries at a very young age. It can start at 3 years old, and then we can start putting it on our coronary arteries usually about 5 years after that. So it could start as early as 8. So, like when you hear about those things, it makes you feel even more passionate about educating kids on how important their heart health is, and how the things that they do now really do affect them as they get older. The other thing I see a lot in pediatrics as well is why can't I think of what it's called? Not coronary artery disease, congenital heart disease, brain fog. So we'll see VSDs and ASDs, and it's important for kids and families to know about the heart. I feel in general to understand those conditions because they're really scary to patients and to parents. But if you can explain it, and especially like the smaller ones like an ASD or a VSD that doesn't need intervention, it makes them feel a little bit better about it because they understand the overall like anatomy and physiology and pathology of the heart. So I think it's just really good to educate on that super early so that we can take that information and keep us healthy later on in life.
Yeah. So a lot of the listeners of this show are practicing PAs. A lot of them are parents. So how can we, as parents or PAs or people who have kids in our lives that we love, encourage our kids to be heart healthy and then to grow up to love movement and not sort of have it be this like, oh, dreaded exercise?
That's a great question. The big things I always encourage with my kids is I don't like talking about numbers at all. So I don't talk about weight or BMI or any like lose weight, gain weight. I don't like that in a sense at all. All I tell kids is that I want them to be eating healthy and to be exercising. And so eating healthy includes having just a well-balanced diet. So in proportion, of course, so keeping good proportions. So we want to get a little bit of everything and not a lot of anything specifically. So as long as we are encouraging kind of that like overall healthy relationship with food, I kind of always tell parents that we want to start, and patients too, that we want to start good habits early because it's so much easier to keep good habits than to break the bad ones when we get older. So I feel like if parents can encourage their kids and the parents themselves can also do those habits, which the kids are learning from, then they'll just kind of set them up for life with these good habits instead of when they're 18, they realize, oh, I've been drinking so much soda. This is going to be awful for me. Now, how do I get out of this habit? And then I also encourage, as you were saying with physical activity, to make it fun. So I don't like the idea of exercise isn't a bad word, but it can have a connotation with it. So it's more just like move your body, whatever you want to do that moves your body, gets you off your butt and does something. That's all it is. We don't have to make it scheduled. We don't have to make it organized. We don't have to make it anything specific at all. Just something that kids are going to feel excited about. That makes them want to get up and move. And it's not more of like a daunting task of like, oh, every day at 5, I have to get up and make sure I walk around for a half hour. Even for adults, that stinks. Like I don't want to organize like the treadmill because then I get home and I'm like, oh, I'm so tired. So imagine for little kids who are like, I don't want to do a schedule. So just encouraging kids that whatever it is, whatever they find fun or whatever they think is appropriate for them is fine as long as they're moving their body for a period of time and that it's happening relatively consistently.
Mm-hmm. Yeah, I think the minute that you make it like regimented, the minute that you make it mandatory is when your kid is like, I don't want to do this. Like, this doesn't seem fun because you're like gonna make me move. But, if they like, my kids love to dance, like sometimes I just send them outside and tell them they're not allowed to come back inside, and they move more outside than they do inside because they just have more room. But yeah, making it not so, okay, we have to get our 30 minutes of exercise in, that doesn't feel spontaneous. It doesn't feel fun. And like kids like routine, but not like mandated movement. That doesn't feel like a way that, that's going to be like effective with kids. The other thing as a parent that I have found is, and I sort of have mixed feelings about this because I love to exercise without my kids around because I can have an actual uninterrupted like focus on movement without them saying like, mom, mom, mom.
But also, there are a couple days a week that my husband goes to work early and I am doing my workout when my kids wake up. So I'll be down here working in my office, I'll move over and work out, and they will usually wake up during that time. And they are so used to me working out that they will like, I have little tiny weights I used to use for Pilates that are like 1 and 3 pounds. So my kids are like, okay, doing the thing, and they're used to seeing me move my body. And so that becomes in their mind just part of like, this is normal. This is what people do. Like people exercise, they want to be healthy, they want to be strong. And then I think the other thing that I want you to address, if you could, is that I don't hear this a ton from my kids, and I would love it to stay that way, is like, how do we get them to understand that this exercise is not because we want to change the way that our body looks, but rather because we want to change the way that our body like feels or functions? How do we approach that in a culture that values thinness above almost everything else?
That's a really fantastic question as well, because I address this all the time in peds, especially with young females. I always talk about like, I don't want girls to go on Instagram and think that they need to look like these people who are filtering and putting all of these different editing tools on their bodies and making themselves look like they're perfect, because nobody's perfect. So we don't want teenagers to have that expectation, or children in general, of I need to look like this or I should have this type of figure. So the way I always say it to kids is if somebody was the exact same height as me, same everything else, but they weighed 20 more pounds than me, they may eat way better than I do and they may exercise way better than I do, but it doesn't mean they're any worse or different than me because their body's different than mine is. They might have more muscle. They put on fat in different places. They have a different metabolism. So I always explain to kids that I'm not talking about image when I'm talking about wanting to exercise and to eat correctly. I'm talking about preventing long-term disease. And so sometimes I'll be like, do you have family members with a condition, or have you heard of diabetes or high cholesterol or high blood pressure? And they'll say yes, or, grandpa's had a surgery because of it, or has had a heart attack or whatever else. And I say, we're not saying anything bad about grandpa, but that's not something that you don't want when you get older, right? You don't want to have these conditions because it probably scares you now. Imagine when you're there, it's going to scare you even more. So the reason why I encourage the diet and exercise so significantly is because I don't want you to have those horrible conditions when you get older. So I think that's the emphasis of that. And I do always say as well of like, we only have one heart. We only have 2 lungs. We only have 1 liver, 2 kidneys. We only get one shot at those. And if you have to have a second one, something went really wrong. So we want to make sure we're taking care of those organs now so that they don't have problems when we get older. And I think, as you said, kind of emphasizing that it's not body image that we're enforcing, or not enforcing, that we're encouraging. It's like an overall health or well-being that we're trying to encourage. And in pediatrics, I think it's like invaluable because there are so many body image issues, and some parents unfortunately do play into it, and it can be cultural as well, where they're like, well, she needs to lose weight, or she needs to look better. And their overall idea is that they don't want them to have long-term conditions. But to young girls, it feels like you're telling me I'm fat or I need to lose weight and whatever else. And that's like the absolute last thing that I want to happen in my office. I don't want a kid to ever walk in and think my pediatrician or my pediatric provider thinks I'm fat and wants me to lose weight. If a kid leaves that, like thinking like that, I did my job entirely wrong. So big takeaway is making sure that we're preventing long-term conditions, and sequelae is a word for it, but lower quality of life by encouraging diet and exercise.
The PA is In is supported by Mastering the Medical Industry, a digital course made up of the step-by-step plan you've been searching for to get out of clinical medicine and into industry, even with zero experience, including 7 hours of on-demand teaching, plus access to a private Facebook community, live group coaching, and even an option for one-on-one coaching with PA and founder Rachel Elaine Jurgensen herself. This course covers it all. Head to onepatientatatime.com/waitlist to save your spot in the next cohort for Mastering the Medical Industry.
And I think as a parent, there's also opportunities for, like, my kids will occasionally, like, oh, we were at a birthday party, we had pizza and cake and ice cream. And then later they'll say, like, I don't feel so great, right? Like, I feel like I ate too much and then I ran around. And like, I'll say, like, well, why do you think that might be? What did you eat? And they're like, well, I had I don't think I was really hungry for that cake or that ice cream or that like last bag of chips or handful of whatever that I had, but I ate it anyway. And I think there's lots of opportunities for us to say to kids, like, well, how did that make you feel? Or like tuning into how your body is feeling. Like our kids will deny till the end of the earth that they are ever tired, which I don't understand because I'm like, you are tired. Like, I'm like, you seem tired to me. And they're like, I don't feel tired at all. And they're like, crying and, just can't function. And I want to raise kids that get that, like, the only person that can like really tune in and figure out what you need from a food standpoint, what you need from a sleep standpoint, what you need from a movement standpoint is you. And that when you're an adult, there's no one there telling you like you're tired, go to bed, that you have to decide that on your own. Do you have any tips for like helping kids to understand those cues or like tuning into their body so that they're not so like, well, it's dinner time, I guess I'll just eat what's on my plate, rather than really saying like, what am I hungry for? How hungry am I?
Yeah, I think that's another great question. A lot of times what I kind of tell parents, especially with like toddlers, is I always tell parents to encourage the healthy eating. So put it on their plate every single night, whatever it is that you guys are eating that you've cooked at home, put it on their plate. But if they don't eat it, don't fight with them too much, because it's just going to turn into kind of, like you were saying, an unhealthy relationship with food, where at one time they're saying, well, now I'm being forced to eat. So, and maybe I truly am not hungry. Then they feel like they have to eat at whatever time because they it's a routine or it's scheduled. So it's kind of in the terms of parents is encouraging them to always have those good habits, but also letting them, as you said, speak for themselves on when they truly aren't hungry. And toddlers are difficult there. They do pretty much whatever they want. It's their world. We're living in it. But but of just having kids, I think encouraging verbalization as much as possible, and encouraging them to say, I am hungry. I am not hungry. Why they're upset, why they're saying they don't feel tired, even though they obviously are acting tired. Why are you throwing a tantrum? Why are you doing all these things? If we encourage them to talk about that and to openly tell their parents how they're feeling, I think they'll have a much better like relationship with food and with their bodies. It's hard with kids because you do want to say to them, like, you have to only eat when you're hungry or until the point of getting full. But a lot of kids just don't, I don't want to say get that feeling, but they just don't understand that. So as you were saying of telling a kid, like, you want to eat to the point of until your belly starts to, I don't want to say hurt a little bit, but starts to feel like it's stretching a little bit, or just feels different, or you start thinking about something else other than food. Because if you're super hungry, you're probably going to not think about anything but wanting to eat. But if you start thinking about going playing and doing anything else, you may not be hungry anymore. So kind of trying to encourage them to pick up on those external cues and internal cues, as you said, because they're the only person who are in control of that. And then I also think just encouraging healthy communication and healthy relationship with food is super important as well.
Yeah. Sometimes at our house, I will feel like we have 4 boys. I mean, 2 of them are teenagers. Eating is not a problem for them. They will eat and eat and eat. But sometimes our little guys, I will see them and it's like they're so hungry at the beginning of a meal. Then they're just like ravishing, like they're eating, eating, eating. And they're like, I want a 3rd helping of, chicken. And I'm like, okay, like, which is fine. And that's available to you. But maybe you should just take a break. Right? Maybe you should just take a little break and I usually say, see if your mind like catches up to your belly, like see if you still feel hungry in just a couple minutes. And I'll just be like, 5 minutes, just sit at the table. Everyone else is eating. You can just talk. And like, then if you do want more, you can always get more. But sometimes you just start eating just because you were so excited to be eating that you sort of forgot what the break looks like and that cue of like, this is enough.
And then also too, I don't can't say for specifically if studies have shown it, but I've heard so much in the past too that when you eat quickly, you're more likely to stay hungry because obviously it's moving through your system so fast that your body hasn't been able to deal with it yet. So when kids are, scarfing it down real fast, they might still actually feel hungry because it just hasn't all settled in their stomach yet. So by encouraging that of like, hey, let's maybe wait 5 minutes and see, are you still hungry? Or maybe if we go a little bit slower, you might feel that you got fuller faster than you even thought you would. Or making it a game. I feel like with kids too, of like, hey, let's play this game of let's slow down the eating and let's see who can tell me more about how their body's feeling than somebody else, or competition, because kids love competition. But
Yeah.
just
Or just like, yeah, just like asking them, how do you feel right now? Like,
yeah,
do you really think you need more? Like, what makes you think that you need more? How is that
e-
feeling? Just so that they
exactly.
can
And kids
tune
are
in.
so smart. Like if you educate them that like if you eat so fast, you're gonna be more hungry. They often listen if they know why they're feeling that way. They generally, I mean, some kids are, they're little stinkers and they're independent and do whatever they want. But in most cases, and that's because they're just super smart. But in most cases, if you explain to a kid why this is happening and what the course of action they should take is, that they'll take it. So I feel like just parents being super open and verbal with their kids is super helpful.
And the other thing that I have found with my kids when it comes to food specifically is that I try to be very diligent about what I tell them about foods. So we try not to say like, eat something healthy, or like carrots are healthy and chocolate is bad, right? So we'll say like carrots help you to see far in the dark, or, eggs make you stronger. And so my boys have really latched onto this idea of protein. Like they're like, I need to get protein. I'm like, great. Like, here are foods that have protein. Like, we don't want to eat only protein. But there was like a period where one of my kids decided that eggs made him like super strong. And so, like, on the weekends, we would have eggs for breakfast, and he'd be walking around the house, like, picking stuff up. Like, look at this. Like, I had an egg, and like, I can just like, he was like superhuman because of the protein that he got from two scrambled eggs that he had for breakfast. But they really do. They're listening to what you're saying about food. They're internalizing what you're saying. So when you say, carrots make you see far in the dark, and you say it like sort of like a cast off, like, oh, we're just going to have these carrots. Like, did you know that they made you see far in the dark? Sometimes then it'll be like, we're outside, the sun's going down, and my daughter, who's 4, will be like, I can see all these toys so good to pick them up because I had carrots, and it's like months later, that they really like, that was the thing, and they remember it. So, really just like saying like, these are the attributes of food, not labeling like good or bad, and just having be like, food is fuel, this is the different kinds that we need. That has been really helpful for our family.
I really love that you do that. That's great because like you said, kids pick up on it and then it gets them excited to do the right things instead of, as you said, making it feel like a chore. So I think that's really awesome.
Yeah. So I would love for you to take this opportunity to share about your book. So if someone's listening and they're like, I want my kids to be exercising, I want them to know about heart health, how is that a great resource for them?
Yeah, so my goal when writing the book was to kind of just educate little ones on their heart and how to keep it healthy overall. I find it's always been really easy to kind of educate parents on what needs to be done and pathology and physiology and everything else, but to kids it's a whole nother um, beast because you have to break it down on such a low level is not the right word, like such a basic level. So, I mean, I would even have, because some kids sometimes say like, what's the heart? And you're like, how do I explain this organ to a child? So that was kind of the driving force behind it, was trying to find something that explained the heart and how important it was to somebody who has such a low health education. So it's kind of like a very basic outlining of anatomy and physiology, kind of the things I explained to parents already, but on an even more simplified level. explaining how it brings blood to the body and the arteries and everything. And I even put a little thing in there about how the arteries help, and I explained it and I even put something about like blood, because sometimes kids don't even know what blood truly is. And I'm like, how do you explain so many of these things to a little kid? So that was the kind of the overarching goal of it. And then towards the end, it kind of just talks about how important it is to keep your heart healthy. So it's a kind of like a fun sing-songy rhyme to it, that's exciting for kids. And the imagery, I tried to make it very what's the word, uh true to anatomy, but also fun, so it wasn't creepy. Because like an anatomical heart's a little creepy, so you don't want to have just that on the main cover, but making it where it's still staying true to the fact that your body's an organ and your heart doesn't look like the classic Valentine's Day heart sitting in your chest, but that also makes it that kids want to get involved. And I've had a lot of people say to me like, "Oh, the kids loved it. They asked to read it again another night," which like made my heart want to cry, because I was like, that's so cute that they like it. But yeah, it just kind of, it gives kids, I think, like a really baseline level of understanding of their body, and then how they're directly responsible for keeping that healthy.
Mm. I think that's really great. And I think kids of all ages are really, they crave that ownership and sort of understanding like, this is my body. And when you're a kid, you can't control a whole lot of things, but like knowing that what you do directly results in how healthy you feel, how well your heart works, is so, so wonderful. So what's the name of the book and where can we find it?
Yeah, absolutely. The book is called The Art of Being a Heart, and it is available on Amazon. It's available for paperback, and it is also on the Kindle.
Oh, nice. Yeah, good. All right. So I want to change gears a little bit and talk about your personal health struggles, if you're willing to share about some of the things that you have walked through. And sort of, I think you have this unique view from being a patient and a provider. And I'd love it if you'd share how this experience has changed the way that you interact with your patients or trust them or listen to them differently.
Yeah, as I was a CNA previously, on a labor and delivery unit. Um, and I've had experiences in the past where people haven't always been super nice. And so when I was when I was in PA school, I had this idea of like, I want to be a provider who is always tolerant and who is always very nice to people, because I've been the person who has not had people be nice to me. So that's always been kind of an overarching thing for me. But then recently, as you said, I'm obviously a provider, but I've had my own health issues lately where I had basically. So I'm 27, or I was 25 at the time it started, and I had some urinary incontinence issues, and I saw several providers, GYNs, urologists, who just kept saying to me, it's overactive bladder, or it's from my leap, or a variety of different things. And I kept saying, I don't really think that's what it is. Like, this doesn't seem normal for a 25-year-old to be going through these things. I had urinary tract infections and a variety of other problems along with it. And it just kept kind of like hitting this wall of like, it's overactive bladder. It's this, it's this, it's this. And even as a provider, and I'm a relatively non-confrontational person, so I'm not going to be like, no, you're wrong. But I also was like, I'm really trying to tell you something's not right here. So I kept hitting that wall and I don't want to say not standing up for myself, but not being firm with it. And then, so I kept just, again, being told that nothing's wrong with me. And eventually I ended up seeing a Urogyne who basically told me that I was having pelvic floor dysfunction. And so I had prolapse of my bladder and my uterus, and I was having herniation of my rectum into my vagina. And he also did the testing. I can't remember what it's called, the manometry, and they told me I don't have overactive bladder. So it was funny because all of these people said overactive bladder, and then he did the test that shows overactive bladder, and I don't have overactive bladder. So it's everything but overactive bladder. So it was super frustrating having like all of this medical knowledge and knowing something was not right with my body and constantly being told everything's fine. It almost felt like they were telling me it's in my head, or that I'm being dramatic, or that, like, especially females, I feel we're constantly being told, like, oh, that just happens to females. Oh, menopause, that sucks, that just happens. Oh, bad periods, that sucks, that just happens. Oh, like, there's just so many things that I feel like women are just told, eh, get over it. That's what happens to women. So so it was very frustrating being a medical provider and having that experience, because I did have so much medical knowledge of, like, I could look it up and be like, all of these things I'm finding say this isn't normal, but everybody says I'm normal. So thankfully I got to the right provider who's wonderful and listens very, very well. My PCP is fantastic as well too, but it's made me realize the importance of truly listening to patients and not going in with a preconceived notion, or not I call it kind of like active listening. So we're in the US, and just in general, we're very big on thinking about the thing that we're going to say next, and that instead of thinking of just what the patient's saying or the person's saying, or getting worried about awkward silence. And so then we're like, I got to fill that silence with something. What am I going to say next? And so I feel like I've really tried in healthcare to erase that idea of, like, what am I going to say, and really truly listen to what they're saying, because you'll miss a lot of things if you're so in your head. And then when you miss all of that, you come out with a notion of what you think is going on, but you have no idea what you just heard. So that's one thing that I feel I've come out as a provider. And I think just taking people's experiences as truly bothersome or is significant to them, even if for some reason you don't feel it's significant, it is significant to them. So take that into mind when you're telling them what you think is going on. And I in my practice, I'm very like, I am not at all saying or dismissing your feelings. This is just what I'm thinking. Correct me if you think I'm wrong or if I missed anything. So just kind of integrating that into my practice of truly caring about what people are feeling and their symptoms, and formulating a plan after all of that has happened.
We interrupt this broadcast with a very important announcement. You are not making enough money. Your practice and your physician do not understand the value you are adding to their patients, and therefore you aren't earning what you're worth. If in the past your requests for a raise have been met with one single word, no. If you're working more hours than ever and seeing more patients, but you're not making any more money and you're feeling pissed about it. If you feel like you've hit the ceiling of your income band, this guide is for you. I've compiled the 5 most costly and most common mistakes that PAs make when asking for a raise, and I've told you how to avoid them and what to do instead. Download your free guide at tracybingaman.com/mistakes.
I have had a similar experience relatively recently with my own health, where I had to keep pushing. I was having this tachycardia and I was like, something is wrong. And I would go to this specialist who would say, go to this other specialist. And specialist A would say it was specialist B's problem or system, and specialist, vice versa. And I kept pushing, and and which is exhausting as a patient. It takes a lot of energy to keep being told, like, oh, this is fine, you're doing better, this is fine, and feeling like I can't live like this isn't a sustainable quality of life for me, this isn't something that's okay. And I had this one visit, which I will never forget, and I definitely think has changed the way that I practice medicine, where I got a same day appointment or next day appointment with the cardiology provider, and I walked in, and I truly believe this person, I was the last visit of the day. I was the youngest, healthiest person that this provider was probably going to see that day, right? No cardiovascular disease, like no history of heart attacks, like no chest pain. I was simply having tachycardia. And so this provider walks in the room and says to me, so you're having palpitations? And I say, nope, I'm tachycardic, right? So those two things are different, right? My pulse is elevated. I'm not having like subjective palpitations. I'm like, I do feel it pounding when it's going 150 to 180 at rest, but it's not palpitations. And then they say, when are these palpitations happening? And I'm like, it's tachycardia, like, and it's happening all day long. And this is when it feels, and then they say, so you're anxious. And I say, well, I do feel anxious when it's happening, but I don't feel anxious before it starts. So I don't believe this is anxiety as the source. When I am tacky, I do feel a little anxious about not being able to control my heart rate. And they said, so you're having an anxiety attack. And I'm like, no. And like, I was like, what, are you going to ask any questions? Like, don't come into this room and just like start making statements. Like, that's not how you take a history. You can't tell me what happened. And then they're like, so you had COVID. And I'm like, no. They're like, so you had the vaccine. I'm like, well, that's true, but this symptom started, 12 months before that. So I don't think we can blame that. And then they were like, you need to eat more plants and drink more water. And I was like, honestly, that's probably true for almost everyone in the whole US. But you didn't ask me how much plants I eat or how much water I drink or if this has changed, if I've changed my diet or like, and I was like, great. So those are lifestyle modifications. Like, what are you treating with that? Like, what do you think my diagnosis is? And they were like, well, we don't know, but everybody gets better if they eat more plants and drink more water. And I was like, that's not a plan, right? Like that's not a diagnosis. That's not an evaluation. That's not a workup. And they were like, well, what do you want me to do? And I was like, well, I want this test ordered. I want this referral to this specialist. And they were like, okay, and I just felt like, gosh, this provider doesn't even care about me. They think I'm fine. They think I'm a young 30-something-year-old woman who has anxiety, who's like shouldn't have been on their schedule at all. And as a patient, I could feel that, right? Like I understood like this person doesn't really care about my symptoms, about my experience, or about working up what I have.
And I believe you actually posted on Instagram too that it happens much more frequently to women too. I mean, the word hysteria comes from hyster, which it means, uterus. So it's that idea of that women are more dramatic or that they're making things up or that these symptoms are not as significant as we're making it out to be. And I don't know if you had similar experiences, but I felt a lot of times I would think to myself, is this all in my head? Like,
is it me? Yes.
Yeah. Am I making this up? Am I making this worse by getting anxious about it? Is this all truly in my head as everybody's making me feel? And a lot of times I would have to say to myself, you literally can't make up urinary incontinence. You can't make up urinary tract infections. You can't there's so many things that I had to say to myself, like, these are not symptoms that you can make up in your head. These are true somatic things that are happening. So it's very frustrating to be made to feel like you're actually a crazy person.
I had that same experience and I have a smartwatch that like tracks my heart rate, like variability, like low heart rate, high heart rate throughout the day. And I remember saying like, oh, like I literally woke up one night in the middle of the night and it had happened before. So I was like, it's happening again. And then I start scheduling these appointments and I'm like halfway down this road to figuring out what's going on. And I start to have that thing. Is this just me? Like, did I suddenly develop anxiety for no reason with not a ton of stress? Like, is it me? And so I pulled up the data from my smartwatch and I was like, this is when I was good. And then this was my max heart rate when I was symptomatic. And I literally remember taking like a deep breath and like, okay, it's not you. It's real. Like I had to prove to myself something that was happening that I was experiencing in my own body was real because so many people had told me, like, I think this is okay. Like, I think you're better. Like, I think resting 110 to 130 is fine. I'm like, it doesn't feel fine. Like, that's not also objectively, like, that's not what we say when we look at vitals. But also, like, I am here telling you this doesn't feel good. It's not sustainable to me. And I mean, a lot of like this data on being a patient and being a woman is like, oh, women used to present atypically, which I personally question. And the reason that I question that is because oftentimes they study men. So they study men for heart attacks, they study men for strokes, they study men for these things, because historically they have said, well, women, you have to take into account where they are in their cycle or, different things. So men run on a 24-hour, hormone cycle. So it's easier to study them than women who run on a 28-day cycle. I am not an expert at this, but a lot of times they would exclude women from the study because they would just say too many variables. And then you learn in PA school, men present with a heart attack like X, women present like Y, women present atypically. Well, maybe women present atypically because we never studied them before. If we studied them, then we would have a typical presentation for someone who identifies as female or is anatomically or, hormonally female. Like I refuse to accept women present atypically because half the world is female. So that's just how women present. It's not atypical. It's just what we haven't studied in the past.
And that's in general. I agree with the idea of haven't studied in the past, but just haven't studied enough in general. I don't understand how we can say people in general or women are presenting atypically or they're not presenting within this box of this is a textbook diagnosis. I was 25 when these symptoms started. So of course nobody's going to think I have my pelvic floor, and I've never had children. So nobody's going to think my pelvic floor is falling out because I don't fit that mold. But we don't have enough data on half of this stuff, especially things like endometriosis and autoimmune diseases and whatever else. We don't have enough studies on this stuff to specifically say what a typical presentation truly is. So how can you just say to somebody, well, you're not X, Y, and Z, so you 100% don't have this condition? It's insanity to me. I had I think she's 14 or 15, female who she presented with a variety of autoimmune conditions, and she actually ended up having Chiari malformation on top of it. But she had ground glass opacities on her CT scan. I think it was short-lived, but then she had petechiae that she broke out in everywhere. She's had joint pain. She's had headaches. She's had kind of atypical autoimmune symptoms that didn't fit in one category, but all screamed autoimmune. So I did an ANA and it came back at 1 to 1,280 or something, a ridiculously high number. It might even been higher, but then of course all of her reflex antibodies came back negative. So I was like, oh, I don't know what to do with you, but I really do think it's autoimmune. Maybe it just hasn't seroconverted to whatever else yet. So I sent her to rheumatology. Rheumatology then says, I've seen a higher ANA. So they didn't care the number. And then they said that her symptoms were not autoimmune and that they didn't seem to fit anything. And that they basically said what they said to you, anxiety. This seems like you have anxiety and your anxiety is making it worse. You're not, she didn't say specifically that you're not truly having these symptoms, but you're making it all worse or making it more in your head by worrying about all of these things. And my patient came back to me and was so upset because she was like, I don't think I'm making any of these things up. I really am having, she's a 14-year-old who can barely go to school because she's got all these symptoms. So that broke my heart. But then they didn't recheck her labs. They didn't do anything. They just said, I've seen a higher ANA. You have anxiety. Peace out, Girl Scout.
I'm unimpressed. I'm unimpressed by the things that are making you unable to live your life.
Yep, exactly. And luckily I rechecked her ANA. It came back. This time was lower, 1 to 360. And then her scleroderma antibody started coming up positive. So I was like, if they literally would have just taken another 5 to 10 minutes to go, you know what, let's just recheck it to see if it's a consistent issue or if this goes away or whatever else, then they would have realized that she seroconverted to her scleroderma antibodies. So it just was so frustrating. I was like, this poor girl.
Yeah. Yeah. So there's a term for this, right? Medical gaslighting or gaslighting in general. Can you help us to just define that? So as providers, as patients, as parents, as people, we can be more aware of what it is and just more cognizant of trying not to do it ourselves or realizing when it happens.
Yeah. So medical gaslighting is the term for it. And it's kind of just dismissal. I think that would be probably kind of the border or the baseline word for it, is just dismissing symptoms when thinking they're either not significant or they're not pertinent to whatever the patient thinks it is or thinks is going on, or that it's not pertinent to their overall condition. And I think in gaslighting in general is just not truly listening to a patient's concerns. It also can be, which we're all a little bit guilty of, but just going in with a preconceived notion of things. Like I walk in and, as you said, I see a young, healthy 20 to 30 some year old female, and I immediately go, there's nothing wrong with you. Why the crap are you here? So it's that idea of like, I know more than you. I have a medical degree. You don't know what you're talking about. I am going to give you the stamp of something's wrong or not wrong. And then, and I think, sorry, my brain. And I think the way we combat it is by listening. I think that's the biggest thing, working on, not that people aren't compassionate, but working on putting ourselves in other people's shoes, being empathetic of like, what if you were going through all of this? How frustrating would that be for you? Especially somebody like us. I think it's even more frustrating for people without medical knowledge because they can't speak for themselves, but especially somebody with medical knowledge, it's frustrating because you're like, I'm not dumb. And not that the other people are dumb, but you're like, you're making me feel dumb and I'm not dumb. So of just truly listening to what your patient has to say. And I think the way we say things is so important. I have a patient who I do feel we've done the workup for everything. We've done all the workup and everything is still coming back normal. And so we still send them to the specialist to make sure everything is good. But I had to kind of bridge that of saying, like, I am not at all saying that your symptoms are not real or that they are not significant to you. They are 100% significant to you. And I am so sorry that you are going through all of this. But I do feel that maybe some of our mental health is weighing into this. And then I usually go into like the brain body connection. Our brain is connected to our body in such a significant way that truly if you are thinking about or worrying about a symptom so much, you may be able to facilitate that symptom. So if we word it in the sense of like, they are not crazy, they are not making this up, but that worrying about things or that certain mental health conditions can play into worsening symptoms. I most of the time I've bridged it like that. I feel like families haven't been upset with me, or I will say to them, I'm not at all saying this thing is not occurring, but from what I'm finding with my evidence so far, we're not finding anything to suggest that that's what's happening, but I'm not at all saying nothing's happening. So I feel just wording it nicely, like just having a nice way of
Being
saying
kind.
things.
Yes, being
Yeah.
kind and thinking about what you're going to say before you walk into that room. I think as providers, like it's normal to have compassion fatigue. And I feel like as I've gone through my career, the further in I get, the more inherently callous I become. And I have to be diligent about not sort of anchoring on something. Like you're working in the ER, your, nurse triages a patient, comes back and tells you so-and-so's in room 4, she says she knows her body. She says she knows something's wrong. Like immediately there's these like things that people say and do that like we start to say like, oh, this person, oh, they know they know they have a high pain tolerance. Like there's just like phrases that like patients have said over the years that have sort of burned us or have not sort of panned out that we then pin on that patient. And I think this is really hard as a provider because you ultimately do have to judge because diagnosis is making a judgment, right? So when you diagnose someone with something, you say like, you meet criteria, this is the evidence, like my judgment is, my impression is X, Y, or Z, my plan is X, Y, or Z. I think the thing that gets us into trouble as providers and can lead us down this road of gaslighting or being dismissive or not taking patients seriously is when we start to make a judgment based on things that have happened in the past with other patients, based on things that we just interpret to be true, but don't like ask or aren't honestly interested in what the patient has to say, because you have seen a similar patient in the past, but that patient is not the same as the one sitting in your exam room. And so you can't hold, all of this evidence of other people against that person, which is weird because you also use your experience in having seen the previous people to help you diagnose the current patient. So how can you use that evidence, that experience, that like things that you've uncovered, things that you've ruled out in other people to have to help you diagnose the new patient, but not to judge that new patient or not to dismiss them or not to not take them seriously based on other people in the past.
And I think it's super difficult too, as you were alluding to, is when you have 15 minutes. You in ER, I know it's a little different, but when I'm an outpatient, like I put somebody in a 15-minute slot, and let's just say it's for some dizziness or something, and the nurse comes in and tells me, well, mom is 100% sure something's wrong. And it's like, how do you, within 15 minutes, erase your previous or preconceived notions about a patient that you've seen with similar symptoms or whatever else, while also taking into effect the experiences you've built from that, while also making a subjective and objective interpretation of what's going on with the patient. So
and
it
then
is
communicating
hard.
the plan and like answering the
Yes,
questions. I mean, that's not even 15 minutes is not enough time to do like the history or the exam or the discussion or the plan or that work that you need to do in your own mind. Like, okay, this kid is a new kid. This is a different patient. This is someone who needs my full, sort of blank slate of judgment, like full of clinical knowledge. Like, it's almost like if you could in your mind, when the nurse says, okay, this person's ready and this is their chief complaint, and the mom is excited or calm or, whatever they say, you take that information and you think, okay, what do I know about dizzy patients? And then when you think about what you know about dizzy patients, like what if you closed your eyes and you thought about all the things that you know about dizzy patients, like it's written on a whiteboard. And then you thought, well, these things in blue are clinical and I know to be like evidence-based and true. And these things in red are my own personal judgments about that. And what if you could just like, I'm not going to focus on the red things. I'm going to focus on the blue things. I'm going to focus on the things that I know to be evidence, to be clinically relevant, to be facts that I know and not things that I feel.
absolutely. And I think it's hard to do, especially like I said, in a time crunch. Like, how do you take, like, if I took that for every patient, it would be a 45-minute appointment for every patient. And I'd love to do that with every patient. And then when you're running behind, and as you said, and you're tired, you haven't peed in 6 hours, you haven't ate, you haven't had time to breathe, you just go in and start. And so I'm not at all saying like it's not hard to set aside the preconceived notions and the frustration and the burnout and the compassion fatigue and everything else, but we have to. Like, I know it sounds so like, oh, it's easier said than done, but we have to, because people's like mental health and their well-being and their trust in medicine relies on us doing our jobs and doing it in an effective and compassionate manner. So it's like I said, it's not easy, but I just feel like, and I don't think it's taught enough either, is the other thing. And I don't think there's enough policy set up in medicine in general to give providers and to give healthcare workers time to decompress and to process these different things and whatever else. But I feel we can do it. We just have to, we have to teach more about it, but we just have to, I don't know the term for it. We just have to find, I guess, a way to be able to do that.
And I think that for me, when I think of problems like this and I think of like, well, the healthcare system and insurance reimbursement and burnout and like and I start to go down like the spiral of doom of like all of the things why healthcare is like terrible and going to try to kill us all, then I think like, okay, what could we do instead? Right. So like if everyone listening to this episode simply took one deep breath before they walked into every patient that they see's room today and just thought, I can't change the whole entire healthcare system, but what I can do is be cognizant of my own bias and focus on compassion. Like, okay, that's one thing. It's one deep breath. It's a thing that you do before you see every patient. You will see changes in the way that you listen and the way that you relate to people simply by doing that, because right now you're not. You're totally right. We're not taking a deep breath. We're not taking time to like, okay, what I just saw, I'm going to let go of. What I'm about to see, I'm going to focus on. And have a phrase, have something that you say to yourself where you're like, I'm going to be compassionate. I'm going to be caring. I'm going to actively listen. And then you open the door, whatever it is that you just focus.
And I think it's kind of what you were saying too, is like go in thinking, what if this was me? Or what if this was my mom or my kid or my whoever it is, whatever loved one it is? What if this was mine? Would I want that provider to go in and immediately say, oh, well, you're making it up? Or I don't think you have this because X, Y, and Z. No, you would want them to listen to you and care about what you have to say. So as you said, taking that deep breath and thinking to yourself, like, I'm going to be the provider that I would want to be seeing my family. And hopefully that gets us in the right mindset before you go in of compassionate care.
Yeah. Yeah, for sure. Well, I think this is such a powerful discussion. And I know that this isn't something that's like part of the curriculum of a lot of people's like formal education. But the beauty of this world that we live in with the internet and things like this is like this episode can be a part of someone's education, right? It can bring this to the forefront of someone's mind. They can be focusing on their own heart health, on setting examples for their kids, on, relating to patients in a way that is more profound and more compassionate. So Kaitlin, thank you so much for coming on today and for sharing your personal experience and your wisdom on these topics.
Thank you so much for having me. I really enjoyed being on the podcast. It was great.
Thanks. And if people want to connect with you online, to follow you, to hear more about your health journey, the book, where can they do that?
So I am on Instagram and it's at @patient and then .pa. And then I am also on TikTok at the Pedis PA, no dots or anything.
This compassion, this ability to disregard all of the emotional judgments that you've had about patients in the past, but keep that clinical experience, that evidence-based medicine, and what you know to be true in healthcare and about diagnosing someone is a superpower, but it is also something that we need to focus on. What are our personal internal biases? What judgments are we making? What personal, emotional, or professional things are we carrying into that exam room with us? And how can we be a little more diligent, a little more focused, and a little better about compassion and active listening and really thinking, what if this patient were me or a family member of mine? How would I treat them if that were the case? Thank you so much for joining us for another episode of The PA is In, This PA is Out.
Congratulations, you've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.